So one doctor to another doctor. This is my dear, dear friend, Dr. Linda Green, and I am Dr. Kusuma, as you guys know. Pigmented skin. I'm using this UltraClear Laser on a 3D miracle setting, which is a very, very light setting, very comfortable, very safe for treating darker skin tones like 4, 5, even 6. So I'm going to start now. How is that?
Just a little heat.
So you can see it's a light treatment. I did it to myself actually about a month ago. My wife did it about 2 weeks ago, who's also my skin color, and she is doing very well. I did very well with my skin. You can see my skin if you close up. I'm doing Dr. Green now. Dr. Green also works in Coral Springs, and she has a spa herself, and she treats patients in our office with various spa treatments. So you should go check her out if you're in the Coral Springs area. So this treatment is very quick. So the advantage of this laser is that it is called a cold fiber laser because in this particular treatment setting, there's very little thermal heat being deposited in the skin. And I'm able to adjust the density, I'm able to adjust the depth of penetration, I'm able to adjust a whole lot of things in here that make the treatment comfortable yet very effective, and most importantly in this case, very safe. Since I'm of a darker skin tone, I've always had an interest in specializing in treating darker skin tones, and it's been difficult to do because the devices are not versatile enough, and there's a fear factor of creating issues with pigment. And so when this technology came out, I jumped on it quickly because I really wanted to treat darker skin tones because it's a tough thing to do well. The eye area is a tiny bit more uncomfortable because the skin is very thin and delicate, but forehead, cheeks, it's not bad at all. For this 3D miracle setting, many times, you don't even need numbing cream put on for a lot of people, and if you have the time, we do it, but it's not necessary. Dr. Green is an OBGYN, has been in practice for a very long time and extremely experienced. Delivered a lot of babies here. Families. So when you retire from doing OBGYN, we can work together.
Yes, please.
Next day or two, you'll have a little bit of reddish color, or you can, despite darker skin tone, you can see through the skin, and you may get a tiny bit of flaking, which is what I got, but the skin healed very quickly, very well, and it feels great. Use this device and treat it ourselves. The fears treating darker skin tone is how to manage pigment. What you don't want to happen is you don't want to have a phenomenon called hyperpigmentation, which is a reactive process to any injury to the skin of darker skin tone. When that happens, the skin can look dark, and if you overtreat it, sometimes you can also pretty much create what we call hypopigmentation, which essentially means that the skin becomes lighter and patchy. It's difficult to manage, and so and one big reason that can happen is that you have too much thermal injury or heat-based injury or any type of injury to the skin that's not well controlled and managed. And when that happens, the pigment or the cells that create the pigment react as a natural, response, and pigment issues arise. And so when you're able to use technology that creates multiple pulses, controls the amount of heat deposition, and is very precise in the depth of treatment, and done at a setting that has low density of treatment. So many parameters that you can control precisely. It makes it very safe, and that's one of the reasons it's called a cold fiber laser, because of the control that we're able to have on the amount of heat delivery to the tissues. Is that age spots or dark spots, or sometimes wide, small, round, irregular. So those spots are natural. A lot of people get them, and you have to know the depth of the spot, like where is the actual pigment in the skin. And sometimes you can somewhat estimate it well based on experience. Sometimes you can't. And if you're able to estimate it well, and if you basically get the laser beam to treat that particular depth of treatment, you're able to break it up. And so when you do that, your pigment becomes a bit darker, and it surfaces and kind of sloughs off in a sense. And so it's effective for that. But you may need a couple of tries to get it. It definitely will lighten up, but maybe not enough, so you have to go treat it again.